The general principle in treatment is that we treat those with the highest risk most aggressively. And the 2016 guidelines have defined what makes up the patient group that have the highest risk. And in the guidelines, just like the previous guidelines, anyone with atherosclerotic vascular disease is already at highest risk. But there has been some fine-tuning, and these sentences have been added saying that if the patient has significant atherosclerosis on imaging, then they are automatically also at highest risk. Now, significant atherosclerosis in imaging is a concept that needs to be defined much better. Is it the plaque burden, the percent stenosis of plaque, or anything else, or even the vulnerable plaque? But for today, we are using significant plaque either on CT angiography or carotid ultrasound as significant atherosclerosis. For today, imaging is mostly used for risk stratification in intermediate risk patients, but it may be used for this highest risk group for a different purpose. There is a subgroup of patients which are even at higher risk within the highest risk group, and it's important to find them out and treat them aggressively. The newer concepts are suggesting lower is better, and with new add-on combination therapies like ezetimibe or PCSK9 inhibitors, we aim to go even lower in a certain subgroup of patients. So which are the riskiest of the high-risk group needs to be defined well. For today, we have a few parameters, like having had an acute coronary syndrome before, or the criteria that the TIMI group has devised to define better which is at higher risk. But imaging will definitely have a role here to define the highest of the high-risk group as well. CT angiography and 3D ultrasound of the carotid are promising imaging methods. But we must not forget that these are not cheap methods, so there needs to be some discussion about cost effectiveness as well. After the Fourier trial, we saw that even lower levels than we had anticipated before do decrease the risk of the patient of having a myocardial infarction and stroke. And this is very important. But since we're not able to give these medications to everyone, imaging may be just one of the factors to help us choose who needs the medication the most.